If you received a late diagnosis of autism, ADHD, or some other neurodivergent condition, you may have felt a combination of emotions that you didn't quite understand. So today, what we're going to be doing is discussing what many people experience and explaining reasons why that might be the case for you. Welcome to Life Divergent. I'm Trina.
And I'm Jason. Quick reminder before we get started, we are not doctors or licensed medical professionals. Please do not use this as a substitute for professional medical advice.
All right.
All right.
So,
So,
were you done?
I
Did I
was.
cut you off? Okay.
You did not cut me off.
All right. Very good. All right. So, what is post diagnosis grief? Um, some people, when receiving an autism or an ADHD or any other type of neurodivergent diagnosis, can often experience a complex mix of relief and grief. It's a normal mourning process. Not everyone feels it, but it can be not necessarily for something that's lost today, but for what we might have been, what we could have been, just what might have been different if we had an earlier understanding of what was going on with us and a better support system.
Yes, one of those emotions, as you mentioned, is relief,
Mm-hmm.
which is finally having words for your experience.
Right.
Maybe validation for everything you've been going through. Then
Yeah.
there's grief, which is mourning those years without support, all
Mm-hmm.
of those frustrations, misunderstandings, confusions, just this maybe an emptiness of not knowing what's happening, wishing you had it different.
Mm-hmm.
And there's the sense of identity that eventually develops as you reshape how you understand yourself. That can be a difficult process full of its own emotions.
Right. Um, so, a lot of people do mourn what they perceive as unrealized potential or missed opportunities in life due to a lack of proper support and understanding, just not feeling like you even knew who you were.
Yeah, there are lost opportunities that you might see. It's easy to focus on the past instead of focusing on the forward. You may have
Right.
had career paths that felt unreachable.
Mm-hmm.
Certain relationships, either romantic, friends, family, shaped by misunderstanding. There
Yes.
may have been an educational support that you never received, and you may have abandoned goals. There's burnout, there's the lack of focus and the self doubt, and you might think that having that support system would have kept that from happening. You might be further along, but
Right.
we need to do our best to maintain forward focus.
Correct. But again, it's perfectly normal to look back and grieve what could have been, what wasn't. Um, it's a normal part of this.
It's hard not to.
Okay, so another thing that people can experience is, you may have discovered and not realized at the time. Of course, you may discover that you've been masking all of your life, hiding who you were, not understanding why you didn't quite fit in. And as I said, you might have been hiding who you really were, whether consciously or unconsciously. And that's an exhausting practice of hiding your true neurodivergent self to fit in. And that can carry a grief all of its own. It means mourning the authentic self that you suppressed and the self trust that you abandoned.
Yeah, it can cost energy. Having to do the dance, put on the smile, that constant performance that you're putting out as part of masking drains your cognitive and emotional reserves,
Mm-hmm.
you lose touch with who you are, compromise your identity because you're having to
Right.
put on the mask so much. And after years of suppressing who you are, you don't trust your own instincts anymore. I mean, all of this comes with the diagnosis, the late diagnosis grief. It's a bundle of emotions, a basket of feelings you don't fully understand. It's a lot to fight through.
Yeah. Um, I experienced this a lot my whole life. I was always made to feel strange. Um, I I don't know to what extent knowing this would have made a difference, but I suspect that it would have made a difference for me because it would have made me understand that it was okay to be myself, that it was okay to trust in myself, no matter what people thought of me. And, maybe I wouldn't have tried so hard to fit in. I don't know. Um, maybe if I had shown my authentic self, maybe I would have found better friends, friends who were supportive of me, instead of, being friendless. I'm okay being friendless, but, who knows? Maybe things would have been different for me. I'm not sure. Um, but, you know, that comes back to years of struggling, burning out, absorbing harsh criticism, simply for functioning according to a neurotypical standard. The grief can be layered. There's sadness for the pain that you endured and disheartenment by the systems that weren't yet prepared to help you. Um, yeah.
Yeah. Yeah. So though if without that knowledge, without knowing what you were truly experiencing, you're not able to explain it well. The words escape you. It's not that they even escape you as much as you never had them to begin with. How do you describe something you don't fully understand? So
Right.
when you have those struggles that are not understood or recognized, your burnout might be misread as laziness. If you're feeling sensory overwhelm, the lights, sounds, all the people, maybe you were told that you're just overreacting.
Right.
Your social differences or lack of societal standards, norms, cues, that might just be labeled as rudeness.
Hmm.
And then you're left feeling like you never quite fit in and didn't know why.
Right. Um, Another thing is that, once your diagnosis comes about, you can then start to reflect on the ramifications of a world that was not yet prepared to understand the full impact of a neurodivergent person navigating a neurotypical world, which brings with it its own set of um, obstacles.
It does, in fact, bring its own set of obstacles. You have neurotypical expectations from the world, and you are being judged against those.
Yeah.
The systems are not prepared for you if who you are isn't fully understood.
Hmm.
Your needs, your accommodation needs aren't recognized. You're expected to fit in a box that you can't possibly fit in. You have families and institutions that just missed the signs, missed opportunities for diagnosis, for that support and understanding that you might have benefited from, or the perception thereof.
Right. I mean, fortunately, we've come a long way in the past, I'd say, 30 years or so, 40 years, with recognizing and making the world easier to navigate for people who are neurodivergent. But, for the people who grew up in different times and didn't know, didn't understand, um, those struggles can be very real. So, um, there are several steps that people can take to recover from post diagnosis grief, sorry. And that can involve realizing the ways in which you may differ from the neurotypical community and learning how to navigate the world so that it makes more sense to you. This includes, but is not limited to, the sensory, the social, and the emotional limits of your nervous system. You really need to get in touch with who you are, the way your systems work, the way your body responds to the world around you, um, particularly during periods of burnout when those limits feel most acute. And another part of recovering from the grief, if you do happen to experience, is going through the process of acceptance.
And that's a difficult process. By no means are we suggesting that it's easy to just, accept this thing and it is what it is. But everyone goes through their own experiences, their own symptoms, and some of this may not apply to you, but you will eventually begin to have the acceptance and recognition of maybe that your nervous system has its own thresholds. Sounds and lights and textures, crowds, those can be overwhelming in ways that others simply don't or can't experience.
Right.
You have social concerns, as we mentioned before. These social norms take conscious effort. It takes energy, and that energy is valid. Fatigue it causes is real.
Yeah. Social burnout. Yeah.
And there is eventual acceptance of the intensity of the emotions, the difficulty with transition, and the burnout cycles. They're all part of how your brain is wired. They're not personal failures. And all of those things they're real. They can be difficult to be okay with, but through the grief recovery process, that acceptance will hit and you'll begin to navigate that successfully, recognize it, and by recognizing it, you can have the necessary conversations with those around you to surround yourself with an understanding and accommodating support system.
Right. So, navigating your diagnosis is deeply personal. It can look very different from typical expectations of flat out acceptance to mourning. Sometimes your mourning might present as anger, numbness, deep relief, and all those feelings can be mixed with some sorrow. But I think that regardless of how you navigate your post diagnosis world, it's going to be valid because, again, everybody experiences things differently. But I think that the most important thing is to understand that it can be a process, and to allow yourself the time to grieve, allow yourself the time to look back if you need to, and mourn the person that you may feel that you never got the chance to be because of circumstances. But you know another really important part of it is, as Jason said earlier, is to look forward to how do I navigate my world now that I understand. How do I get the right support, whether that be from the people around you or seeking out, going to therapy on a regular basis, using medication if that's right for you. Just, try not to live in the past for too long. Take the time that you need, but focus on moving forward.
So, is this something that you've experienced, the grief of being diagnosed later in life?
Me?
Yeah, you.
Um, I have some things. Like I feel like as a mother, there are times that I might have not been the mother that I would have liked to have been because I was experiencing burnout or deep depression or, all of the things that come with all the conditions that I have that I didn't fully understand. Um, Maybe I would have gone back to college, to get a PhD or something like that. I don't know. But my life, took a lot of different turns. Um, so even though sometimes I think back on what might have been, I think that for the most part, I'm not grieving it so much as just wondering, what might have been. The what ifs can kind of get to me sometimes. But the other side of it is, you know, I went through the things that I went through, and the things, regardless of how they affected me at the time, I guess it all is a part of who I am now. And I'm pretty happy with me now.
And
So
sorry,
that's
the
okay.
the what ifs can be difficult not to get hung up on.
Yeah,
The what if phase is part of grief. It's the bargaining phase. Just, if I had done this differently, or what would this have been like?
right.
Like you said earlier, you try to not live in the past. It's easy to get sucked up into that
Yeah.
and lose sight of moving forward. And it can lead to some, I don't, is self-damage what I'm trying to say? Self-deprecation, being
Self
too hard on
deprecation,
yourself.
maybe. Yeah.
Have you reached a point, and I'm sorry if that is the case, I should say maybe when did you start being kinder to the past version of you?
I think that immediately when I understood, I mean, I've known for a really long time that I was bipolar, but as far as like suspecting that I might be on the autism spectrum, but certainly after being diagnosed with ADHD, um, uh, more than anything, I felt like, wow, I understand more about who I am now. And I think that I experienced more the relief than grief, if that makes sense. Um,
Yeah.
it's almost like, I understood myself, but it was almost like I found me when I was diagnosed because so many things made so much more sense. I mean, I was only diagnosed with ADHD, what, like a year ago, maybe a little bit more now. But I mean, I'm 61. So, I mean, it was a long time coming, I suppose. But um, I guess to some extent, I consider myself fortunate because there are people who live their entire lives without understanding maybe some of what they might have considered to be their shortcomings or pitfalls and that kind of thing. So, really, mostly I experienced relief. Mostly. Yeah. It's nice to understand yourself for a change instead of wondering why all the time. Why am I like this? Why do I feel this way? Why can't I feel better? But now I understand why I felt the things that I did. So, yeah. What about you? Have you had any experiences at all of a better understanding of yourself or regrets or grief or anything like that?
I was fortunate enough that I understood me. Not,
Hmm.
I never thought about me compared to other people. Like why is someone able to do this when I can't?
Yeah.
I always focused on just how to overcome my problems or shortcomings or struggles, which
Yeah.
might have been easier had I received an earlier diagnosis. But when I did, it was just like, oh, okay. That
Yeah.
doesn't that by itself didn't change anything for me. It was the information that came from that that would allow me to get support or talk to the right people for tips for addressing certain situations.
Yeah.
So that is always helpful. And that's why we always say go to a licensed practitioner, mental health professional, because
Right.
the label itself doesn't change who you are, but the
Mhm.
recognition of something will give you the the access to tools, trip
Trips.
tips and tricks. I can't even say either of those. Things that you need to or can benefit from. See, I don't like using the word need. Could
Yeah.
benefit from is where I tend to go.
Benefit. I mean, it certainly is helpful in terms of understanding yourself better. Um, because I feel like I don't know what your experience was as a child, because I could only live my own childhood. I mean, I know what it was like to be your mom, but I feel like if I had had a, a mother, for example, who didn't tear me down for things, for my behaviors, for just me being me and making me feel so uncomfortable in my own skin by criticizing me all the time, um, that might have helped. But I do think that, having people in your life who are supportive of you and who you are, how you are, regardless of any diagnosis or any symptoms, certainly can help make a difference, especially when it comes to the masking and self deprecating, that kind of thing. But, you know, for me, understanding who I was and why I was the way that I was so helpful, because it might have been one of the first times in my life that I don't want to say that I felt normal, um, but I felt okay being me, because I wasn't mocked or put down or ignored or just thought to be strange. I'm different, but that's okay. So it was really more of a, oh, thank goodness. Now I know why I am who I am. Um, yeah.
So, what would you say to someone who was just diagnosed?
Um, I think that try your best to use it. I mean, again, you experience what you experience. You can't stop what you feel. However, I think that accepting yourself for who you are is really, really important. Um, Understanding and accepting who you are, um, and try not to stay in the past too much. Just look forward and think, now how am I going to use this information going forward? How is this best going to suit me? How can I best, I, this sounds corny, but how can I best honor myself and live to my fullest potential? And actually, not just what you might think is your fullest potential, but reframing what that means, what your potential is, because you might have had a false idea of what your potential was based on what other people, the narrative that other people have written for you. So, write your own narrative and move forward, I think. Yeah.
Solid.
Yeah.
Wise words.
All right. So, anything else you'd like to add before we wrap up for the day?
I think I am all set.
You think you are?
I think
I don't know why I just stuttered right there. This has been pretty deep for me, very reflective. But anyway, yeah. All right then. So, join us in our next episode when we talk about the difference between limerence, if I can speak, and love.
That
They are
is
different.
yes, they are different, and it's difficult. It's hard to accept that maybe what you think is love is not. But
Right.
if you want to know what we mean, this is the place to be next time.
All right. So until next time, take care of yourselves. Bye.
Bye.